Directors panel hosted by Pathways and PM&R. I'm SJ and I'll be your moderator for tonight. And I'm here with my co-leads, Paul and Emily from Pathways and PM&R. They'll be monitoring our chat and keeping us on track today. We're also really grateful to introduce our incredible three panelists, Dr. Chowdhury from Burke Rehabilitation Hospital, Dr. D from Baylor College of Medicine, and Dr. Prideaux from Mayo Clinic, Rochester. Okay, so thank you all so much for being here and supporting us. So just a quick note before we start, we've curated today's questions according to your submissions and reflected the most commonly asked ones, and we'll go section by section. So if you have any other questions during the session, feel free to drop them in the chat. And our dear panelists, please feel free to respond in the chat if you'd like for certain questions. As you know, this session is being recorded, and please stay muted so that we can hear our panelists clearly. All right. So after the panel, make sure you complete our post survey with the QR code right here. If you fill it out, you'll receive our brand new IMG Match Survival Guide and will be then turned into the raffle for a one-on-one counseling with IMG PGY1s. We're such a new team, so your feedback really means a lot to us, and your contribution will be really, really appreciated. This link has been shared with you via email earlier, and we'll share the QR code again at the end of the session. All right, so let's get started. Let's start with the personal statement. I know this is something many of you are working on right now, including myself, so hopefully this will be helpful. Our first question is, what qualities or themes in a personal statement stand out to you?
I can get us started. So, thank you to everyone for joining and for submitting all these wonderful questions. I think for myself, and it might be different for other people, but in a personal statement, I want to see what your motivation is going into residency and that you understand what all of a PM&R residency is. It's also a good opportunity to give context to your application. So if there's something positive you want to highlight or something negative you want to give context to, it's fairly helpful. In my own opinion, it's helpful if it's something negative, if you're just direct about it rather than talking around it. So let's say you failed your pediatrics rotation because your mom was in the hospital. That's okay, but you don't have to talk around it for 5 paragraphs. You can just be very upfront about that, and it's very helpful to know.
So
Thank you.
I agree. I feel like one thing that stands out to me is if it comes across as genuine and authentic, rather than very depersonalized. Like I want to get to know you, um, what makes you uniquely you, and it's an opportunity to tell your story and just be genuine about that.
Yeah, so I couldn't agree more with my two colleagues. The other thing for me too, so we tend at Baylor, we do look at the whole application. So we screen everybody. So I as Dr. Chowdhury is saying, kind of more direct, I would say limit your personal statement to like 1 page as much as possible so that you can kind of be more concise. You may not be able to cover, of course, a lot of things, but yeah, what makes you you, what stands out, and also try to piece, as we said, the context together. Um, One of the things perhaps sometimes if there's something as like for example, not making it to the first round of step one or whatever. Yeah, as Dr. Chowdhury has alluded to, um, and aside from the reason, what did you learn from that experience, right? What did you take from that? I think that would also show a little bit more of like how you take some of these challenges that come through.
Thank you. We'll move on to our next question. What are some common pitfalls that applicants should avoid in their personal statements?
I think that Dr. D mentioned one, if it's too long. We read a lot of stuff. There's a lot to read. And so I agree that a good goal would be to try to keep it to a page less or a page or less rather than going on to the second page. Um, the other thing that I don't always love to see is if someone is writing and already is very clear that they're going to subspecialize. You know, the PM&R residency is broad and vast, and you do all of the different things during residency. And so we want to see someone who has interest in all the different areas rather than someone who very clearly just has interest in one area. Um, Not very common, but make sure that you review it and have someone else review it because you don't want to have any grammar mistakes in there because that doesn't look good. But
Thank you. That was really helpful. If it's okay, we'll move on to the next question. Uh, this is interesting. Do you prefer personal statements that highlight unique personality or story, or should the focus be more on professional qualifications, even if those might overlap with other parts of the ERAS CV or application?
For myself, I prefer the unique personality and story. I think when you go through many of them, finding that thing that sets you apart, and it's almost then when we interview a good jumping point for conversation, helps us get to know you if we're going to spend 3 or 4 years with you, uh, an entry point into what kind of person and resident you might be with us.
100%. Like Dr. D said, we review the whole application. So we don't necessarily need the personal statement to repeat what we can learn in the rest of the application.
Thank you so much. So this was a very great start. Thank you all doctors. And let's move on to the ERAS application, ERAS CV part, especially the 10 meaningful experiences. So number one, do you prefer to see experiences that show a broad range within PM&R, or is it fine if someone focuses more on one area or subspecialty, for example, sports medicine? I think Dr. Prudo has discussed about this briefly at the personal statement section, but we'll be open to any nice opinions from you, doctors. Thank you.
Yeah, I would echo Dr. Prudo's comment on that. As I said, you're entering a PM&R residency. It's okay, of course, to of course say if there's a specific leaning, right, towards some subspecialty. But with because this part of this is also showing like you truly understand what PM&R is, right? And not just one part of PM&R.
Yeah, I would say, I mean, just showing you've had like inpatient experience on top of like the sports and pain stuff most people have. So like, if you've done 3 electives, if all 3 are in sports, that's probably not as good as if you have one inpatient experience.
And then just to say in the meaningful experiences, it's okay to include experiences that aren't PM&R related at all. If it's something that you're excited and passionate about and you've put a lot of time and effort into it and it means a lot to you, include it. And
Awesome. Oh, sorry.
I also think in this area that it's always great to show that you've had recent experiences. So if I look and all the experiences are, pre-medical school or more than, 10 years ago, but nothing is recent, I think it's nice to see that you're doing these, experiences over time rather than just all of them being a long time ago.
Awesome. Thank you so much. Um, we'll move on to the next question. Is there a preferred format for this section? For example, short paragraph, bullet points, or anything else?
Honestly, I don't care.
Right.
I don't know if anyone else does, but I don't care.
Yeah, it just depends, I guess, how you're able to get your points across, right? So yeah, we don't, yeah, this doesn't matter as long as whatever you want to share, is there. So
Thank you so much for sharing such helpful advice. Yeah. All right. Our last question for this section. How important are research and U.S. clinical experiences when evaluating IMG applicants from foreign countries?
Yeah, I would place an emphasis on, I guess, U.S. clinical experiences, especially so like I'm in the New York City area, so I'd like to see that you have an idea of like what the healthcare system here is like, the positives and negatives. I don't know if you're coming from Denmark and it's a top two healthcare system in the world. And then you set foot in one of our city hospitals, it might be pretty different. So showing you have some clinical experience is important to me.
Yeah, I agree.
mm,
Really great to have that clinical experience and get a letter of rec from someone that you worked with in the clinical area. Um, as far as research, I mean, I think that we all like to see a well-rounded application as part of our holistic review, which can include research, committee involvement, um, like the Pathways program, leadership experience potentially. Obviously, if you're involved in a research experience that's like 1 or 2 or more years long, it will be good to show productivity from that. But I think overall, that well-rounded application um, is what I love to see rather than maybe just a ton of research and nothing else.
and I agree too. So add to that, not just research, like scholarly activities, writing, something for the community, for example, on healthcare, so those things too would count. As Dr. Purdue is saying too, like the well-roundedness as well of your intellectual curiosity at the same time. The of course can't overshadow the clinical experiences. And I think just kind of I think because I think that one of the things from a clinical experience is also important is also not just like long time ago or in a different context. It really has to be also in the medical field, because some people might be here and then doing some other work, for example, right? Um, as long as really geared towards learning, as Dr. Chowdhury says, the U.S. medical system, because there's quite a bit of nuance there too with regards to healthcare, and all the other things that how we do medicine here. So
Amazing. Thank you so much. All right. So next we have one quick question for geographic preferences, but rather broad. Um, how much does this section, geographic preference section, affect interview selection? Is it better to indicate a preference or choose no preference?
well, for us, I don't think it matters a whole lot from a geographic preference, especially now with more signals. I think that's for me, that would be much more important rather than geographic preference.
I
But I
yeah, go ahead.
Sorry, I was just gonna say, but if of course if you do have it, then it's there, right? But this is it. It's less of a thing for us.
Yeah, this is just like from my own personal experience, so it only applies to really my residencies. I traveled far away from where I did medical school to do my residency training. And I am always kind of interested if there's other applicants that are in that same situation. So it's nice to see people from the other coast wanting to come east or from down south wanting to come up or from overseas, things like that. Um, so as long as you make it clear you have some interest somewhere, whether it's like a personalized personal statement or the geographic preference.
Yeah, overall, I would agree. I don't think that, let's just say, I don't think I've never ruled out an applicant just because they didn't give us a geographic preference. So I don't think that it means as much as Dr. D said, as getting an actual program signal, especially now that we have high signal numbers. Um, so
Yeah, these are very wonderful perspectives. Actually, for most of the IMG, since they're coming from foreign countries, most of them don't really, have specific geographic preferences unless they have certain reasons to prefer certain places. So to hear these opinions really helps a lot for all of us. Thank you.
although I do question, I think there's the option to put like something like urban like preference. And so when someone applies to my program in Rochester, Minnesota, that says wants urban, I'm like, I wonder if they know what Rochester, Minnesota is.
Yeah, that
Anyway,
totally makes sense. Yeah. Thank you so much for clarifying. Thank you. Alrighty. Then let's move on to the letters of recommendation and slows. So we have several questions here too. How do you view letters from an applicant's home country, especially if they had long-term clinical experience in PM&R there?
Yeah, I personally value that because I do want to really that was the purpose of the letter of recommendation for me is like somebody who knows you very well, who could really allude to like your performance or how you do think your personality, your character. I think that is very important. Rather than just have anybody locally here, but that you have not necessarily worked with or who don't know you very well. I think a combination, but if the recommendations that you have are mainly all from your home country, that would probably, I think be much better, rather than, as I said, just any letter, than just any letter, but here in the US.
agree.
Awesome. Thank you. There's another question here. And it might be a question for all of us, not only for IMGs, but what do you think makes a strong letter or slow? Could you also share any memorable examples?
Well, the slow is brand new, so no examples to share from that. I think we're all learning along with you all about how that will work and how we'll use it and interpret things. But I think one of the proposed benefits of a slow is that it allows comparison, um, maybe a little bit of an easier comparison between applicants from their clinical performance standpoint. Um, just in regard to reading narrative letters of recommendation, sometimes those comparison things can make a difference. For example, if someone says, I've been in my position for 20 years, clinical experience, this applicant is, in the top 5% of medical students that I've worked with in all those years. That can mean a lot if you're having some of those comparisons. Or clearly functioning at a higher level um, than their level already, like functioning at the level of PGY2 resident already, certainly can tell me a lot. But yeah, there's so much variability in letter writers. So I also like to see if there's repeated themes across different letter writers. If there's clear strengths noted as a theme that all the letter writers are talking about, then that really means a lot to me as well.
Thank you. Would there be any other ideas about the strong letters or slow? Okay, amazing. Um, Now on to signaling. So this year we have an increase to 20 signals, as doctors have already mentioned in the prior sections. So we totally understand that this is a new process, not only for us applicants, but actually likely for all of our program directors as well, like the impact of signals and stuff and etc. So please just feel free to share your thoughts as comfortable as you can be. Just a heads up. With the increase to 20 signals, how much would signals affect interview selection or ranking?
I think, yeah, it's also to be determined. But for us, so I foresee it. So we do have, um, when we put together our rubric, right? We do have, program signals as one of the category, um, that adds some weight to it. So that's how we kind of use it for our interview selection. Um, I am not sure. It will probably be a significant thing because before even if we had the same categories coming through, I don't think a whole lot of people were actually using signals, a whole lot either. So, this probably would definitely, I'm sure, probably change some of the dynamics. But we're at least for us, for our program, we're not necessarily going to change the way we do the in our process in terms of interview selection. We don't do it, we don't use it for ranking.
So, with it being new, I don't plan to use it for interview selection or ranking. I plan to review everything and whoever I feel is the best to interview. But for the past few years, I've also been advising the med students that are applying about signals. I think the best advice I can give is be very critical of your application and realistic about it, and then be realistic about where you want to send your signals. Especially when there was, five or so, it's different than now there being 20. A lot of people are saying that'll be like your cap on interviews, like basically 20 programs you would apply to since you have 20 signals. Uh, so if you're a candidate that's a candidate for the top 20 places in the residencies, then that's realistic. But if you look at yourself critically and that's not you, then you need to look at what might match up more with where your application stands.
Yeah, and I'm just playing off that, having an advisor, mentor that could review your application and give you feedback on um, the strength of your application, and which could potentially help decide where the highest value of using your signals is. But yeah, the high signals, it's a learning thing, right? We're all learning together on this. I agree with Dr. D. We don't use the program signals for ranking at all, but certainly can play a role in interview selection as part of the holistic application review, like Dr. Chowdhury said. Um, the Yeah, with the high signals, I mean, I guess thinking about our program, it might be hard to invite someone if they didn't signal us. We're not your top 20 that you wanted to signal. So how interested really are you? But I know that's not the case for everyone. I know sometimes there's different reasons someone might not signal us. So we're learning.
Yes, it's just like the emergence of slows. I think increase of signals. These are all for applicants, what I feel as an applicant myself, so that we can choose the programs that I can really be a good fit to, or somewhere that I can really shine. So as an applicant myself, I think slows and signals both are all new for all of us and for directors too, but I think we can totally choose it wisely if we can really truly understand how it works, and we don't have to just worry about interview selection and ranking because that's not all of it, I guess, in my perspective. Thank you so much for your opinions. Now I'll move on. Let's discuss interviews and post-interview. First one is what kinds of post-interview communication are welcomed or expected? Do you think thank you notes or letters of intent after interview impact how you rank applicants?
Uh, I guess so. I mean, nothing is expected. It's always nice, but it doesn't affect at least how we rank people. And like in the interest of like not committing a match violation, I just tend to not reply. So it's not like a anything personal that I didn't say. You're welcome, I guess. It's just it just gives you it keeps you from accidentally saying or doing something. Uh, yeah, it doesn't hurt in any way. I don't think it would hurt. One thing that some candidates did that I thought was helpful is they would put their ERAS photo and ID number in the signature also. So, like a month later, it jogs your memory as to who that is that's sending you the thank you letter.
Yeah, I agree with Dr. Chowdhury because so sometimes, much as I would like to, acknowledge, the letter, but I already know I'm not going to be able to keep up, So in order to just be equal and all that, then we don't have it doesn't have any bearing. Just take it basically from your side. How would you do it, right? Is if it's a courtesy, from the applicant standpoint, but I hope that but I would say not an expectation from us. It shouldn't have any message basically whether or not we respond, because as Dr. Chowdhury and we try to just also be as equitable as possible, not to be misinterpreted.
Yeah, I agree. I don't know that I have much to add. It's nice to, get a thank you. But the we always tell people during interview day, like if we hear from you, don't feel bad if you don't hear back from us unless you ask a specific question. If you ask a specific question, we'll try to reply and answer, but otherwise don't feel bad that they didn't hear back from us after you sent us that. And I agree, the letters of intent and thank you notes, it wouldn't change ranking to receive either of those.
All right. I think I wanted to ask one more question specifically about letter of intent, which is slightly different from thank you notes. Thank you notes are mainly thank you for having me to your interview. It was really nice talking with you. But letter of intent is more like thank you for having an interview with me, and I'm really interested in your program, and I ranked you as my top five or top blah blah blah. I think those are slightly different. I just wanted to ask if those might make a little difference.
A little difference in regards to what? If you're wondering about if it impacts ranking, no.
Hmm.
Um,
Hmm.
but yeah, it doesn't impact ranking for us to get those. Um, I love to hear it when people love our program. It's always nice to know if people love our program, but um, it doesn't change our ranking of them.
Thank you so much for your.
Oh, you're muted, SJ.
Oh, I'm sorry. Thank you so much for your awesome perspective, Dr. Vito. That was what I said. Let's move on to our next question. Um, this is also an important question, I feel. What are some common mistakes IMG applicants make during interviews? And what advice would you give to help them stand out?
For me, I think one thing is it's similar to the personal statement. It's just being yourself. A lot of the times um, I guess since we've been doing this quite a bit and we do it in a large volume of people, we kind of already know what's scripted or kind of like prepared. Yes, there are those perfect kind of answers, but we are not looking for perfect answers. We're looking for your answers or your responses, how you do things. And we actually ask a lot of what we call behavior questions. So it's like, what did you do something in the past that would have said, that would have described some of the things, how you handled some things. And so, of course, I think that's where we just wanted to know, again, as Dr. Prito was saying, like, I personally would like just to know who you are, where you're coming from, what your experiences are, um, and how you approach things. So yeah, just be yourself.
I couldn't agree more. Um, if it's too rehearsed, that comes across as ingenuine. But we just want you to be genuine or authentic and be yourself, and we want to get to know you. Um, so don't think about what you think we want to hear. Just be yourself and be genuine.
Thank you so much. All right, finally, we are going ahead of time, but that makes us more time to ask additional questions. So we'll wrap up with our last section, which is IMG specific questions. Um, what are the most common concerns programs might have when considering IMG applicants? Yeah, this might have a lot of different perspectives and views. Again, please feel free to answer as comfortably as you can be. Thank you so much.
Dr. Chowdhury, do you want to?
I don't know. It's so there. I've worked with a lot of IMG residents, and there's been really great experiences and really great motivation. I think often like learning the U.S. healthcare system or how care is delivered differently here is always like an early issue in training, but one that is part of our job to train you to learn that. There's also American medical grads who don't understand the healthcare system as well. Um, there's like all the stuff outside of the actual training where there's visa stuff and the way the US is going and stuff like that, but I don't think that should really affect your perception of how the trainee themselves are. Um, I would say other things might be like cultural differences. We had one IMG doc in training that his bedside manner was by the patients we had perceived as being a little rough, but it was just the way he was used to acting and behaving from his culture. Uh, so I don't know. How do I find that balance of telling someone how it's done here versus how he was raised and taught was an appropriate manner to behave?
I agree with Dr. Chowdhury. The one thing I've noticed, having IMGs, especially in the recent years as well, is like they adapt in differently, right? You know, sometimes I understand it may take them probably a little bit longer, maybe a year, to adapt to like both the culture because they're also kind of both learning the clinical part of it and then also how to get assimilated and adapted to both the culture and also the culture of medicine here. I'm looking back at my own experience being an IMG as well. It's like it did take me a while to kind of get my bearings as well, in terms of, how do I respond to even both my program, my supervisors and also patients. So it's not a concern. I think it's just something that I think in addition to the clinical, I understand that there's one other thing that an IMG would probably have to also develop that learning curve, not just from an medical learning or medical knowledge standpoint, but there's another area of it that they have to really adapt into and adjust.
Mhm. Yeah, I was trying to think if I had anything to add. Trying to think about any other things that um, PDs might be thinking about. I guess if there's been a big gap from your time in medical school and clinical experience, might there be concern with that? Something to consider. Um, I think there's probably some degree of unfamiliarity in regards to your training and the quality of your training and education in medical school from U.S. program directors. Um, the Again, we talked about the importance of the clinical experience in the US, to learn different things. And I know sometimes that experience is more of a shadowing experience, which maybe doesn't lend to as much confidence as if it was a more hands-on experience. Um, And then I don't know, with the state of our country in recent times, I don't know if anyone would have concerns about where if delays could come in with visas or that sort of thing, but just some different things to think about that maybe we didn't have to in the past.
Thank you so much. These are all were like awesome and really genuine answers. It really means a lot. Thank you. Um, for IMG applicants who have graduated from foreign country, is requiring visa sponsorship or not a major factor in selection decisions?
I don't know how major it is, but it is an important factor. So definitely if a program, this is where too, um, you want to be intentional and research what programs and which programs take a J or an H and what is your preference, right? Because that's pretty much set. We can't really change things. And so if you're looking for an H with a program who cannot sponsor H, don't, yeah, don't send in your application because it's not going to happen, right? From a sponsorship standpoint. So that's one of the limitations definitely that is uh just obvious. So
Yeah, it's going to be program specific, but definitely do your research and see where there's a history of having IMG residents. Uh, and don't be afraid to like reach out to the program coordinator maybe to clarify if they only do H1 or if they do both H1, J1, stuff like that, and know which one you're going to require, obviously.
Thank you so much. Awesome. Now, this is our final question before we move on to our other questions through the chat box. As PM&R becomes more competitive, are applications still reviewed holistically, or are there cutoffs, such as exam scores or year of graduation? I think a lot of doctors have discussed this in our previous sections that applications will be reviewed holistically, but if you do have some viewpoints about year of graduation or scores, please feel free to share it with us to the extent that you're comfortable.
No cutoffs for us. We just review every application holistically.
yeah, likewise for us. This is where perhaps like your year of graduation, I agree with my colleagues here, because it does reflect, so or we would tend to question like, okay, what is your clinical experience rather regardless of where it is, right? In terms of the practice of medicine. Because I understand sometimes people might have to work different jobs, for example, just because they're waiting for their visa or other things, right, before, proceeding into residency. But your activity, what you do in between those times, it does say a lot. It will kind of also give us an idea, really, like, are you really going into medicine, or what steps did you take? Even if you had to take a different job, what things did you do that shows that you truly are dedicated to becoming a physician here in the United States? So this is where, not just giving the year of graduation, we don't have a cutoff in that sense because we review it holistically, but this is where a lot of your explanation, if you can, that's where being explicit about it and open and honest, I think that would, and straightforward about it, what you do about it, that I think that would be very much appreciated in reviewing the application.
All right. Thank you so much. So I know some of these have been really quite hard to answer, and I really appreciate all of your kind answers. I have some other questions on the chat box, so I will be addressing them one by one. So number one, circling back to the personal statement, if I think Dr. Chowdhury have addressed about some limitations that I have or why PM&R should be emphasized. If an applicant were to pick between those two, discussing red flag or discussing why PM&R, which would you choose to look through the personal statement?
Maybe you can still discuss both. Both are important.
Yeah,
I
I
mean,
think so too.
And I think um, trying to recall, but there's like we talked about the meaningful experiences, but there's also like an impactful experience, right? So could you use that within the application to explain one of the red flags or something, and that gives you the opportunity to say how it impacted you and how what you learned from it and how it made you better, and then you use the personal statement for your story and your why PM&R. But as long as it's in the application somewhere, I think you would have the opportunity to address both somewhere in the application.
Thank you. That is also a very great suggestion to use other sections of our application. Thank you. Um, Regarding the ERAS 10 experiences section, are there any recommendations on how to pick the top three most valuable experiences?
Guess I would say which ones mean the most to you? What did you feel like you put the most passion in? What means the most to you? What could you talk about more about? Because anything that's on your application that could come up in interview, and you, if it's something that you can't talk much about, you might not include it. But the things that mean the most to you that you feel like you could talk more about, and that you've really put a lot of time and effort into.
Thank you so much. Um, I see doctors have been answering this one on the chat box too, but just in case there are other viewpoints, I will be asking once more. For the letters of recommendation, do you feel a slow, which is new this year, is better than a traditional letter of recommendation? I was just curious as this is the first year within slows being integrated for PM&R.
no, I agree with Dr. Chowdhury's comments. So right now, we'll take both either. So we're all kind of treading this pilot phase as well. And so it will not be taken negatively against an applicant if they don't have a slow. So no bearing, I would say.
There, with the slow there, I don't know how much you've looked at it in detail, but there is still the option to have some narrative comments within your slow. So um, it's not just data and answering questions. There is an opportunity for some narrative input in the slows as well.
Thank you so much. I see a couple of more questions here. This might be a bit, this might have a lot of various answers, but if you have any examples popping in your mind, just feel free to share with us. Can you explain how IMGs can get PM&R US clinical experiences like clinical rotations, observerships, etc.?
So I know there's certain healthcare systems which have almost like their own registrars for observerships. Uh, and then some are kind of done off the books through the department themselves. I guess the general advice or like things I've noticed is usually it's easier if you do something in the outpatient side rather than the hospital side. There's a lot more hoops and onboarding to go through for that versus the outpatient clinic, which might be outside of the hospital. It might be easier to do an observership without having to go through as much bureaucracy.
I don't know that I have great advice other than to sympathize with how challenging I know it is. Um, I think from our standpoint, I mean, we get high number of requests that we can't accommodate just because it's such a high number and we have so many other learners and um, we're pretty intentional about not diluting learning experiences by having too many people around. Um, so, I mean, if there's an opportunity to be at a conference and meet people in person and make a connection that way, or if you have a mentor or advisor who could reach out to another institution or program for you, um, I think potentially those things can maybe help you stand out beyond the high number of requests that we get. But I don't know if anyone else has thoughts on that.
Yeah, we also have that limitation. Actually, our institution doesn't allow observerships to begin with. So that's where it's like, much as I would like to accommodate and but it's an institutional kind of limitation. Um, Sometimes I think, I'm wondering, like, say, for example, if you have an opportunity to maybe observe in a medical clinical scenario with anybody else, for example, um, I mean, that makes some steps, right? That shows some effort with regard to understanding the system. It may not be PM&R to begin with, but I think that shows some interest in learning about the medical system in the US, even if you're not having hands-on, and particularly in PM&R, because I know it's very limited as well. So sometimes I actually, pass up, people that I know of to my private my friends in private practice just because they probably have a little bit more leeway to host some observers with less restrictions from the institution. But that could be something perhaps that at least it's not necessarily even just for your application. I think it's just basically for your personal growth, for personal kind of exposure and just banking upon, investing on yourself, right? As part of you really wanting to understand and be able to adjust slowly, gradually or better into the medical system. Whether or not you get a letter from them, of course, it's not going to be guaranteed. But I think that's part of the efforts, overall collective efforts that you could do to show your strong interest and really seriousness in terms of really wanting to be in an American setting. Um, yeah, other than that, I think Dr. Chowdhury had, also alluded to like some places that would allow that. But I know a lot of us in the academic, right, and most of us are in big universities, there's a lot more restrictions because we do have a lot of learners too.
Thank you so much. I got another question from direct message. Do you prefer slows to be as many as they can be out of the four letters, or does it matter the number of the slows?
Just one would be fine, I think.
Agree.
Mhm.
I think it's already going to be challenging enough to get one. So at least while we're still learning how to do it.
Thank you so much. Um, there has been one question about AAPM&R posters, I guess. If we've been accepted to present at AAPM&R this year, but the conference hasn't taken place yet, where and how should we reflect that in our application? Is there a recommended way to list upcoming presentations or accepted abstracts?
Yeah, I think I've seen that in some of the applications when they have it in their posters and all that, they just say in the description
Mhm.
presenting accepted at AAPM&R 2025. Yes, I think that is definitely something that I would say please put it in.
Yes, as an applicant myself, I have looked through the ERAS application, and there is a section where you can submit your publication, which wasn't published yet, or which has been submitted but hasn't been accepted yet. You can choose the level of the publication and select which stage it is at. So you don't have to worry about it in my perspective. But thank you for asking. Um, This is interesting. Do you have a preference for prelim ear, for example, internal medicine versus general surgery?
Because PGY 2 year and PM&R involves so much medicine, I would prefer a medicine experience over
Yeah,
a surgery experience.
I would say medicine and I don't know, the advice I gave some of our med students is like that's your only real year of medicine training, and all your friends, family, everyone, they don't know what kind of doctor you are. They're going to come to you with their diabetes, their LFTs, their back pain, their OB stuff. So like getting that medicine here is just going to make you a better doctor overall.
Agreed.
Thank you so much. I'm seeing more questions, but I think these were pretty much addressed in our former discussions, and I'll see a bit more. Oh, um, is it important for us to explicitly state that we are IMGs and how it shaped our journey in our application?
I don't think necessarily you have to explicitly state it. We'll understand that, but if it is a defining characteristic of your medical journey, definitely speak about it.
Thank you. I see one question about slow. Ethan, if you don't mind me answering, there is a website, AAP website, and they have listed the format of slow where you can find the link and you can send it to the writer so that they can submit it through website and download it in PDF so that they can submit to through the portal. Um,
I saw it. I think Zoe's question is kind of interesting if we could address that.
Awesome. Zoe, thank you. I was wondering how program directors view applicants with the PM&R residency abroad. Oh, it is interesting. It is considered a pro with a prior experience, or is it a con, as there might be concerns of whether the applicant can transition into the US clinical settings? If it is a con at a first glance, how would you recommend tackling this concern? Thank you for letting me know, Dr. Chowdhury.
Yeah, I thought it was interesting because we've had some experiences with residents that have done a full residency abroad, and I personally think it's a pro, and you bring a lot of value there. Uh, and like it's almost on your program to also understand that yes, it's different and might not be the same, but you have a perspective and training to offer that might help add positively to your program. And I think you as an applicant should look for a place that's appreciates that, not one that's rigid that says, sorry, that's not how we do it in America. You need to do it our way, sort of thing, or something like that. Be like, that's really interesting. Why did you guys do that like that over there? What was the thought process, or how might we be able to bridge the differences between our two? So I think it is valuable, and you as the applicant should look for a place where that's appreciated.
I love that, Dr. Chaudhry. I guess the other thought is just show that you are coming in with with a growth mindset, right? That you are interested in learning and growing and getting better, and that you are happy to take feedback and incorporate feedback. Just having that growth mindset overall um, is important for everyone, including if you've already done a residency.
That is very encouraging perspective for some of us. Thank you so much. Um, there was one question. Any specific advice for Caribbean IMGs? I am not a Caribbean, but to my knowledge, what I know is a lot of Caribbean IMGs have opportunities to have clinical rotations in the US during their medical schools. Some of them don't require visa, etc. So there might be a little bit of differences compared to other IMGs from other countries. So if you do have specific advice or examples that you can share, that would be great too.
Yeah, so I guess this is a specific for at least New York City areas. A lot of the Caribbean schools have contracts with the city hospitals, and most of the academic programs, their residents rotate through the city hospitals. The attendings are faculty, but maybe like the program director might not be or the chair. Uh, but it is a good opportunity to get like in towards meeting people in person and to network through there. And definitely like forming good connections with the residents in the program can be beneficial to them advocating for you if that's a program you're interested in. Um, I think a lot of like bigger city hospitals and programs probably have graduates from Caribbean med schools working as faculty. So that's another like common connection you might be able to find and use to your advantage.
Thank you. We have about 5 minutes left for this session. If anyone has additional questions, feel free to drop them in the chat. Um, just in the middle, as you can see on the screen, don't forget to complete our post survey, please. And I got another question from direct messaging. Do you have any suggestions for applicants who are reapplying for the match? I think this is not only for the IMGs, but if you have any um, insights to share, that would be awesome.
Yeah. So from a reapplication standpoint, it's interesting over the years, it's almost become like a it's a given that we will be having a good amount of them, a good number of them coming through. I think the one thing is also just sharing like what did they do, in between, um, how they um how they faced um that circumstance, right? That challenge, whatever that might be. And basically, yeah, the response, what did you do with your time in between? And so yeah, this is the same thing as almost like the same category for impactful experiences and all that. Um, I think if you have something to share that's really valuable, it's really from you wanting to let us know your intent and all that. Um, just say it, just put it in the application, rather than us like figuring out the years and all that. And as I said, just be open and frank about it. Because rather sometimes we would ask that in the interview. I do ask that a lot. So sometimes in reviewing the application, I kind of look for like, oh, what did this person do already? That would be the first thing that I would that I have in my mind when I review somebody who's a reapplicant. But we have matched people who are reapplicants over the past few years, and they've been fantastic. So I guess just to put it out there, yeah, they are I would say they're not any different than the first time applicants.
Thank you so much. I see another interesting question here. Hi, doctors. I previously worked as a physical therapist after immigrating to the US and before deciding to pursue residency training. I'm just curious, how is this kind of background as a physical therapist is viewed by PM&R programs?
So I can take that. I'm a physical therapist too as an undergrad. Um, I think it's something that it depends on how, right? Of course, it's part of your application. You could probably make it shine through however you want to use it in terms of like, yes, so that you could have a better, because you have a better understanding of PM&R. So different programs may view it differently. But I think on the other hand, just to kind of reinforce what my colleagues, my co-program directors are saying, I think what is the here and now? What are you doing and how are you tailoring it? Because it's very much related. How are you kind of tailoring it? Is what's your physical therapy background? How does that enhance you being a PM&R physician? And what steps are you doing, towards that? Those are, I think, I mean, in my mind, that would be my question for that person. Probably has that background.
Yeah, I suspect that that's part of your story that you'll tell, like, if that played a role in you deciding to do what you're doing now, definitely include that and shine a light on it, because that's part of the story and you're part of your why for PM&R.
Thank you so much. Now it is 9 p.m. Eastern time, so now it is time to wrap up. Thank you so much, Dr. D, Dr. Chowdhury, Dr. Prito, for joining us and sharing your wonderful insights. It really means a lot. Again and again, 1,000 times of thank you. Attendees, thank you so much for joining us. Good luck for your applications and good night. Thank you so much. Thank you so much.
Thank you.
Thank
Good
you so
luck.
much. All the best to you all.
Thank
Take
you
care.
everyone for joining and thank you guys for organizing.
Thank
Best
you
of
for
luck.
having us.
Thank you so much. Appreciate it. Good night. Thank you.